NHS. Let's speak then to Darren Hughes, who's Director of the Welsh NHS Confederation. Look, welcome to the programme. You'll do this better than me. Just explain the difference, if you can, for our listeners between the Welsh NHS and the Welsh NHS Confederation.
The Welsh NHS Confederation is a membership body representing all of the NHS organisations in Wales as a group. So good evening as well, Gareth. How are you doing?
Good evening. Yeah, I'm really good, thank you. Look, the reason we've got you on is because your counterpart organisation in England has said that time is running out for the English test, track and trace system to be up and running by the 1st of June, which is when some schools are going to reopen, and perhaps there'll be a gradual further easing of the lockdown over the border. From what you've seen and what you've heard, are you confident that Wales's track trace system, which we heard Andrew Goodall talk about there, is on track? End of May, we were thinking. Is it on track? Is it fit for purpose for when it's needed?
It's a very tight timeline, as you're saying, Gareth, and we were really pleased to see that the pilots are happening in Bertie Cadwaladr, Hywel Dda, Powys and Cwm Taff. And what we need to ensure, it isn't just a case of it being switched on, it's got to be effective, which I think the work that's going on at the moment to ensure that it is vital. And I think it's just one part really of the sort of toolkit of measures that we've got to ensure that we're protecting the people of Wales. We can monitor the progress of the disease, and we can ensure that the NHS is able to deal with the patients who are taken ill with COVID, and also, as importantly, people who are taken ill with other serious conditions, because the effects of COVID are not just affecting the people with the disease, it's people with other important health issues as well.
Look, it's an interesting approach being taken in England compared to Wales, or vice versa. In England, they've gone through a private outsourcing company to get their staff on board. Wales going via the route that already exists, if you like, through the public sector. Is one better than the other, or is it? I guess it just depends how it ends up working rather than who the personnel are.
I think, from our point of view, what's important is we've got the best system in place to protect the people of Wales. We've all got a role. Welsh Government are providing the sort of oversight and the direction. We've got our public health experts in Public Health Wales, who are the expert body with the clinicians. And what we are seeing in Wales to a higher level than ever before is, great partnership working between local health boards and local authorities, because as we've heard in some of the press commentary today, and also from the Assembly, that the prevalence of COVID is very different in different parts of Wales, and the health boards and local councils in those areas are geared up for them. It was started earlier in Nair and Bevan, and I think they've probably passed the peak of where they are, but there's some excellent working going on the ground, and ultimately it doesn't matter who's delivering it as long as it works.
Yeah, look, I'm just wondering what your message would be to the politicians and the people who make the decisions. If the system isn't quite where it needs to be by the end of May, would you rather a delay to any further easing of the lockdown until it is right?
I think what we're going to see over the next couple of weeks, and, I don't often stick up for politicians, but the information and the science they're very much changing by the day. As we're seeing a huge increase in the amount of testing being carried out, what we're finding is there are areas of the country and people who have had COVID-19 and didn't know they've had it and could well have passed it to other people. Things are changing quickly, and I think now the prevalence of the disease and hospital admissions are at the lower level. It's important to get this up and running now before any easing of the restrictions, which could inevitably lead to small rises in transmission in the community. So what we need to do is have an efficient system in place that we can monitor and track, and then amend any changes to the lockdown and behaviour. And, what I would like to say is put on record our thanks to the people in Wales who've worked really hard and made some real sacrifices to ensure that social distancing is maintained, and there's, big prices to pay on people's mental health and well-being, on family life, that we've all got a role to play personally, Welsh Government, Public Health Wales, local health boards and local authorities, and we need all to make sure that we're doing whatever we can to manage this disease.
And look, there's so many aspects to controlling this, to moving out of lockdown, to a return to some kind of normality at least. This tracking and tracing system, with all the things that will try to suppress the disease and control it, where does that rank in terms of importance for you?
I think we need the whole toolkit, Gareth, to be honest. There isn't necessarily one bit more important than others. If you had the best tracking system in the world and the public weren't behaving responsibly, that would be no good. What we need to ensure is there's a finite capacity of beds, of staff within the NHS. And, over recent months, our staff have been working tirelessly and going, way beyond what any of us could have expected is we need all of these things to be working together. It's a package, it's a toolkit, and all bits of it need to be working.